you're being, yeah, good.
Sorry.
Okay, fine
Is
now.
this-
Well, yeah, your comments are coming up on the bottom of the screen, whatever you're saying.
Yes, I do have closed caption as an accessibility
Oh, okay,
option.
great. Go ahead then.
Thank you. All right. So,
Oh, and where are you coming from?
yeah, I'll get
Where-
into that. I'm from Columbus, Ohio right now. So actually in 2021, I was invited to direct the efforts to address dating violence, domestic violence, sexual assault, and stalking. I'll just call it DVSAS at Otterbein University, a small private school in central Ohio here. I joined a group of dedicated and experienced campus advocates, law enforcement, prevention educators, all eager to advance their programming, but they were experiencing common limitations of resources and siloed information between programs. And this made me want to find a solution to bring the information that's already collected on our campuses and bring it into our strategy planning so that we could maximize our data-informed programming. So leading me to share with you today, a data inventory tool is an option, a potential solution to enhance evidence-based strategy planning for DVSAS on campuses. And I'm going to share how I did that inventory at Otterbein and also some strengths and opportunities of that tool that I think could be really applicable to other institutions of higher education. So a data inventory or data source inventory tool, it's a centralized document to organize the available data sources or assessment tools maybe given at the end of prevention education programming that would in any way be relevant to DVSAS. So it catalogs the surveys and it provides a centralized document to allow stakeholders to compare the available data, look at it and synthesize concepts amongst that, and apply key insights to create their evidence-based programming. It was adapted from the sexual violence data triangulation tool, pilot version 1.0. Gratitude to Drs. Decker and Mahoney for their work there. And it's compiled in an Excel spreadsheet. So it's open source and able to be adapted by different institutions. And for us at Otterbein, we created 4 categories. These 4 categories, you'll be shown a template of them so you can have a visual idea. It includes data sources. So the first category, we have a list of our data sources, and for each of them, pertinent information about where and when it was collected. The second category, relevant data elements. Each of those data sources then cross-referenced for whether or not, ticking yes or no, it contains measures relevant to perpetration, location, etc. And the third and fourth categories were adapted for us at Otterbein to meet our needs. There were 3 campus climate surveys on sexual violence, diversity, inclusion, and student engagement that had really valuable measures that I could see potentially being useful for other areas of interest, particularly prevention. And we wanted to pull those direct measures out verbatim and show their relevance. And then the fourth category is a result, really data elements not summarized as it sounds. It's a repository of the information that was gathered during our collection process where it wasn't an actual tool that was a result, but from learning about the programs, we became aware of data being collected over the process of engagement in that program, but it's not summarized in a report. And we wanted to keep that and use it for opportunities in the future. So here's our visual on the first category, data sources. So the first column you see, you would name the individual data source and then populate it with what the inclusion criteria was, who owns it. And I do want to draw attention to number of cases reviewed and date where applicable. So some of the data sources might be collections of reports, of incident reports to the Otterbein Police Department or Title IX. But the date itself is indicating that this data inventory is a recurring process. It's something that we're going to be using continually to monitor our work and to guide our strategy planning. The second section, we have the data sources from the first category pre-populated along the top row. And then underneath, we would tick yes or no for whether or not, and these are just the headline categories. There are sub questions more specifically under each of them, about whether or not this data source contains interesting measures that would speak to any of these features of a physical space, physical location, that space affiliation, etc. Very location centric. So added to that, we wanted to expand beyond a lot of location specificity and bring in opportunities for which of these population level data sources have measures that could speak to our interests and bystander values for expanding our prevention programming, the success or perception of prevention education, and then also we have intervention responses and information on resources, perceptions there. We also added community and society level risk factors and protective factors from the CDC for domestic violence and sexual assault, so that we could see potentially maybe we do have population level measures that we can track over time to see if our overreaching objectives of our coordinated community response team to address DVSAS, if those are working over time. We could use those as indicators without trying to spend resources on a impact evaluation. And then data elements not summarized is really just a place to collect those interview results qualitatively and then imagine under potential uses how it could be a future research project or potentially evolve into a regular report. So the methods I used for this, we gathered the population level surveys that we know exist, maybe by requirement through Clery Act, which requires an annual security report, or many state legislators might require a campus climate survey or strongly recommend collecting those, and then beginning an email recruitment of our stakeholders through our coordinated community response team, also tacked in there our director of institutional research, solicited by email, and then had in-person interviews with these departments, subsequent interviews, and for some interviewees, we had a third. The inventory was then cataloged into the screens I showed you previously, and then we looked at the data triangulation amongst those sources. So here, data triangulation more so than like location, GPS, hotspot mapping. We ended up looking at it for themes and what is missing, an exercise in curiosity. So our results, we have 9 distinct data sources were found and inventoried, and we had 12 people interviewed within the 12 campus departments. So here is a snapshot of what the data source category looks like populated. And so now it seems to work as a table of contents so that when we're making future program decisions or if a new program would be implemented, somebody could look through and see the date of when it was the data available, the date when it was collected and inventoried, because an inventory is a point in time, right? We want to be recurring. So as of 10/25/21, we have these data sources. We put the population, our most rigorous data sources, at the top. And then we begin, you see the last one there is Title IX reports, our incidents reporting. And then continuing through our Clery required annual security report, the crime and fire log, which populates the annual security report, but is deserving of its own space here because you can go into this data source and get the disaggregated information on location and crime. Silent witness reports, and we also added, even though they weren't a data source, our advocacy and chaplain resources do not monitor utilization, but because they're so crucial to our response work on campus, we put them here kind of as a placeholder for emphasis that this needs to be addressed. So also, as a result from our interviews and the data triangulation, one, subsequent interviews were so crucial. It revealed 5 additional data sources that initially program leaders just, I think, underestimated their value, thought it might not count because it was an internal document or something like that. So very important to have subsequent interviews in this iterative process of building it. We discovered through the conversations the gaps in utilization, and that those were born from advocacy and chaplain wanting to maintain privacy. So not only a gap to be fulfilled, but also information about what is being protected around it and what needs to be considered as we advance that assessment. Very little location data, but also an emphasis of the limitation of resources. So guiding our next steps that we wouldn't want to create a survey for more location information to do hotspot mapping on our very small campus, but instead pursue the lower resource required implementations like a monitoring of utilization. And also having immediate access to explicit measures and outcomes that relate to our areas of advancement for prevention and bystander values. I think any school would benefit from beginning a data inventory process, whether it's a superficial, just collecting the top 3 things that your school has, or if it's a deep dive, regardless of the amount you can invest in it, there's immediate benefits to the program reach that could be applied from it, the utilization of resources, and certainly the aspect of engaging community partners. We're increasing our relationships together and their relationship with evaluation and data as a guiding tool for our work to be as effective for survivors and as effective for survivors as possible and as effective in prevention as possible. And it could only be enhanced if potentially for new users who have maybe less experience or more trepidation around evaluation, having more guidelines for interview recruitment or interview templates, and providing more options like I had for the cross-referencing for prevention, so that we can include primary prevention in our conversations of data and its uses. And I would also encourage not being the single person creating the inventory as I did, and bringing it into a team of people who engage with this annually so that it has a higher likelihood of sustainability with turnover. Thank you.
Thank you, Susan. Really, really well done. Very, very interesting. I know Michele's been, I saw she was your Capstone reader, and she's been very active in, the process of developing data and understanding what's going on at Johns Hopkins University. So very, very important, and with a particular focus on the undergraduate campus, where the greatest concern lies right now, and where reporting may be more likely to occur than maybe in some of the graduate schools. Given my own personal experience with sort of violence that at least one of my former students experienced. But so I'm interested in, I love the idea that this is thought of as a process within a campus, but I'm interested in your thoughts about the extent to which there can be development across campuses and sharing of data to understand whether your experiences on your campus are unique, or whether there's a pattern across universities in terms of what you're seeing.
Yeah, so cut for time is a lot of interesting information on that. So certainly with CDC's guidance for, we want data-informed programming, obviously, but even with some of our seminal national trends on DVSAS on campuses, even within those, the AAU, they do recommend and highlight the use of local data as being important. It doesn't throw into question our national trends we can see, but there is such variation that there is no substitute for having your local campus climate. Right. That's where in like 2016, that became the national recommendation. So there is something very, there's usually a pitfall of people thinking like, I'm so special and unique, that problem's not a problem for us. And it is, but here's where we get to feed into that and say, like, you are very special, and you do need to ask your specific population how this is happening.
Sounds very, very politic. Yeah,
that's what it is.
Well, I'm sure it is, because this is definitely a very controversial topic. Other questions from people? No, nobody else?
Just have a brief question. I mean, how is this data inventory being actually used? I mean, what is your next step? I mean, are you trying to develop a guide?
Oof, I don't know if I'm going to do that or just try to stay afloat in my own context. For us personally at Otterbein, the next steps that are happening, currently in the process of meeting with each program to talk about what feels accessible and most relevant to them for their next step of either applying existing data or, like with the advocacy and prevention education programs, beginning to meet their needs of monitoring the utilization, because we don't have a way to reflect who is being served, if there are people not being served. And also, I know that they're doing good work. We qualitatively know that good things are happening, but we don't have a way to communicate that or track it over time. And so finding ways to make our next step there and then record that in the data inventory. Like, how do we show our progress throughout that?
Do you have for required education?
Do we have which?
do you have required education for all students and faculty about
Yes.
the topic? You do?
Yes,
Okay,
yes.
all right.
Yeah. So we have that, but we have supplemental programming to that, and that's what's not monitored.
Okay, thanks. Yeah.
And in the meantime, very pleasant to me, I've had 2 student groups and a faculty member come and speak to me about DVSAS on campus, actually in the pursuit of like, I want to do a survey. And it's like, before you do potentially inferior methods survey, do you know that these items are covered in 2019's report of this? And just sharing with them the sort of table of contents for section data sources. And it informed 2 capstone for undergraduate research projects this spring. I mean, obviously that made my heart feel good that it had immediate access and people are turning the data into applied use instead of it being, the resources are expended on so many campuses to gather it and it doesn't get put into practice. And that's what I want to relieve some of the burden on our campus and hopefully others to start applying it and really making the most out of all the time and effort sent into doing it.
Yeah, I love the idea of data to practice. That's great. Yeah, absolutely fantastic. Yeah, really public health in action. So wonderful. Thank you.
Thank you.